We are redesigning the student experience so our students and their families don't have to manage college alone.
We're creating places where big ideas can flourish.
When I learned of many of the historic health inequities happening right here in Richmond, Virginia,
so our
and involving VCU, I thought, I have to teach this.
It is our
where big
vision
ideas can flourish.
to transform the lives of patients everywhere.
When I
We will
learned
do this by
many
leveraging
of the
novel
historic
technologies
health inequities
to take on
happening
high-risk,
right here in
high-reward
Richmond,
problems.
Virginia, involving VCU, I thought, I have to teach this.
We have so many impactful stories to tell at this institution, and I want to say thank you to all of you for being here in person, and of course, those of you who are here virtually, thank you for joining us as well. We're going to make it worth your while, I promise you. Throughout this pandemic, which is of course still on our minds as I look at all of you with masks, it certainly reminds me of that, there's been one constant at this institution, and that is your dedication and compassion to help the people who need us the most. At VCU, students and patients are at the center of our mission, and they come first. I'm thankful for our faculty and for our staff who meet students where they are to help ensure their learning, to help ensure the success of their career, and of course, their personal success as well. And I want to say this as well. This is really important. Having rounded nearly monthly in our hospitals and our clinics, I am deeply grateful to our healthcare team members, particularly our dedicated nurses with whom I've spent the most of my time, who provide exceptional and compassionate care to all of our patients everywhere. Because creating a culture of care for students and patients at VCU changes, improves, and saves lives everywhere. At VCU, our students and our patients come first. So, let me start out by thanking our amazing teams for creating and growing our culture of care at VCU. So let's be honest, the past 2 years have shown us a lot of things, but at VCU they've shown us how fast we can change and innovate centuries-old systems in education and healthcare. Today, we're a stronger institution, and we have moved forward. Our students, faculty, and our community, they're not seeking the old ways of doing things. They're not seeking the previous normal university and the previous normal hospitals and clinics. They want better experiences and more timely outcomes that are driven by their needs. So we'll continue to shake things up. Our teaching, discovery, community service, and healing, these are all the things that are our foundations for our transformative innovations in education and healthcare at VCU. This morning, I'll have the opportunity here to share some, but absolutely not all, of VCU's recent successes. So, I'm going to begin today with a story that only a place like VCU can tell. So it was 30 years ago, Doctors Todd Stravitz and Arun Sanyal became colleagues at VCU. So they bonded over their passion for the human liver and human liver research and how they could help save and improve lives around the world. So for 3 decades, Todd and Arun have worked together, pushing each other and their colleagues as well to be at the forefront of liver research and technologies, and of course, so much more, and we'll talk about that. In the earliest days of the pandemic, many of you might remember that VCU had been selected to lead clinical trials of remdesivir. Well, at that point, it was just an investigational drug, as you remember, in the COVID-19 situation that we were in. Arun, he led a team of VCU experts in a first-of-its-kind partnership among hepatology, infectious disease, critical care pulmonology, and cardiology colleagues. Today, remdesivir is an essential tool in saving lives in this pandemic. I'm very proud of how VCU played a role in this global transformative innovation. So, Todd, he retired from VCU in 2020, just a couple of years ago, And in December, Arun was tapped to lead VCU's new Liver Disease Institute. This is an institute that will foster scientific inquiry, it'll foster scholarship, it will foster learning and education and clinical innovation to help meet the current and future health challenges that are all connected to the liver. But a lot more on that to come, a lot more. I promise you, it's worth waiting for. For now, though, I want you to help me turn our attention back to this video screen, and I want you to look at how VCU continues to shake it up. Meet the current and future health challenges. I am really excited because I'm about to walk into the new VCU Shift Lab. This is one of these great models that represents this transformative innovation that I've been talking about, this transformation of our educational experience that enables our students to learn their way by actually doing the kinds of things that they love to do and to connect with the marketplace. And so we're about to walk in and we're going to talk to a student about this great product that he's come up with. Come on with me. Hey, Julian. I'm really excited to learn about your jackfruit jerky.
I'm excited that you're here. Thank you for coming by.
Yeah, it's my pleasure. Tell me about it and how it came to be.
I started to ideate, think of ways I could create a product that was sustainable, good for the environment, the planet, and healthy for people. I noticed the trend of jackfruit being a meat substitute in the restaurant industry.
What are some things that we need to do better at VCU to accommodate students and give them a chance at the kind of success that you're already seeing?
Getting to work on this Shift space, the Shift Retail Lab, has been an awesome project, and I think the long-term goal for it is a great vision. I mean, seeing all of these products up here today and the potential they have is really inspiring.
Sure.
I think it's a great way to get feedback from not only VCU students, but the Richmond community. I think as much experience you can get before going into the workforce puts you in a place where you're more prepared for that next step.
So as we talk about VCU successes, everything begins with our unwavering commitment to creating a more diverse, inclusive, and equitable VCU, and of course, we wish to impact the world in the same ways. This is a commitment that starts with our nationally recognized work around equity, inclusion, and success. For the third consecutive year, Insight into Diversity, which is a magazine, they have given VCU the Higher Education Excellence and Diversity Award with special distinction as a diversity champion. And VCU, by the way, is only one of 14 institutions to be recognized like this. At VCU, we know that inclusion is the spark that lights the flame in what we call our journey of excellence. All of us at VCU are dedicated to being an institution that serves and reflects all of our communities. This means that we've got to be purposeful about how our actions, how our inactions, words and perspectives contribute to creating an equitable, inclusive, and diverse university, institution, and of course, community. A memorable example of how this happened last fall was when we were all together and dedicated the Murray DePillars building across Broad Street. And this was to honor, of course, our former pioneering dean of the School of the Arts. Dean DePillars was an amazing person. He brought diverse communities together early on, by the way, to learn and to create and to engage in needed conversations that help bring people together. He was just an exemplary artist, but he was also a tremendous educator and communicator who elevated our school's profile nationally and globally. Today, our School of the Arts, among all those schools of the arts out there, privates and publics, it's ranked 4th in the United States. That's amazing, and I'm so grateful for that. And I don't believe it would have happened without Murray. Our Board of Visitors and our Board of Directors continue, many of them are here today, thank you all for being here, continue to champion our diversity, equity, and inclusion work. I'm really thankful for their leadership in everything that we do and for their great support. To all members of our board, Rector Ben Dendy and Vice Rector Carolina Espinal, who's probably watching us from a distance, Thank you all very, very much. Members of the Board of Directors of the health system, all of you have been wonderful. You've also helped us to hold ourselves accountable as a public good. This morning, I'm proud to share the outstanding work in our VCU Massey Cancer Center. During the pandemic, Massey Director Rob Wynn, my colleague, he recognized that faith leaders had really important roles that they could play as ambassadors and communicators for their communities because they're trusted sources of accurate information. So we launched something called Facts and Faith Fridays, which is an open dialogue opportunity between faith leaders and scientific and medical experts, bringing together the intersection, of course, of science and religion. Our community outreach attracted national attention. We've been proud to welcome First Lady Jill Biden, Francis Collins, who was, of course, a native Virginian, but also the director of the National Institutes of Health, Javier Becerra, who is our Secretary of HHS, Health and Human Services, our U.S. Senators, Warner and Kane, Governor Glenn Youngkin joined the group, and of course, former Governor Ralph Northam as well. Caring for our community through the pandemic has been and it continues to be a top priority. And the reason it worked is because everyone in this community has cared for each other. At the same time, VCU Health has also tackled some of the most ambitious projects in our history during the past year. So you might remember, many of you who are patients, that in December we launched a couple of really big things. One was EPIC, our fully integrated electronic health record. That's going to help us, and it already is helping us, make better and more coordinated care decisions, something that every patient wants. We do that with less time and with less work and less headache. This upgrade required thousands of hours of training and preparation on the part of thousands of the members of our team, in IT, but everywhere. People worked day and night. Although we've had a few bumps here and there, I have to say EPIC is positioning VCU to be a leader in real-time, data-driven healthcare and the best outcomes. At the same time that we implemented EPIC, by the way, like literally the same time and day, we opened our VCU Adult Outpatient Pavilion. It wasn't by design, by the way. It just worked out that way. But the Outpatient Pavilion at VCU for adults, it's helped to transform how we deliver outpatient care in our clinics. It's our largest facility ever. The pavilion is now enabling us in so many ways like a linchpin in our mission to expand access and to put the needs of our patients first. You'll hear me say that over and over again, not just today. This is a space, the Adult Outpatient Pavilion at VCU, this is a space that fosters learning. Remember, that's a critical part of our mission. Collaboration among our providers and care partners, and healing. This is what will help to ensure the best and safest possible patient experience at VCU. This pavilion is part of our mission to serve all the patients who need our care. It's also supporting our mission to be the Mid-Atlantic's healthcare system of choice for tertiary and quaternary care. Not every healthcare organization can do that. We know we must, and we know we have to do it well. These are the most complex and specialized services in medicine, and they are more needed than ever for lots of reasons. This is a pavilion that embodies a promise that is also embedded in the work of our Health Equity Initiative and its History in Health program. This is a program now in its third season, by the way. It helps participants to better understand VCU's history and to contribute to a health process that'll bring change that's absolutely meaningful to all of us. So, I ask you once again to look behind me at the screen so that you can see what I'm talking about. Hey everybody, here we are at the VCU School of Dentistry, and we're going to talk today with Mina, who is a fourth-year dental student. She, in her second year, had a cool, innovative health equity course, and she's going to tell us about it. So come on, let's go. I understand, Mina, that Dr. Smith's class is a mandatory class in your second year. Tell me about that class and how it shaped your thinking in terms of ultimately being the best dentist that you can be.
Patient autonomy might be probably one of the ones that stuck most with me because I just never really thought of how my patient would want their care.
How do you feel about this kind of class and its importance to our overall effort to reduce and to eliminate health disparities?
I appreciate Dr. Smith's approach in talking to us about patient mistrust.
Sure.
A lot of history comes with that, and we are meant to learn a lot from our past. So rather than shutting it aside, I think it is so important for us to face it head on and understand what our patients could be going through.
Sure.
And address things that occurred in the past that helped us become the providers we are today. I've grown so much, I've become who I am because of VCU.
So as we celebrate our successes, the rest of the nation is learning about VCU. And in this last year, it's been amazing. VCU, your university, has been featured in the Washington Post, something Monica pointed out to me. She said, look, it's VCU in the Post today. The New York Times, the Chronicle of Higher Education. We've been on the Today Show. Our people have been on the NBC Nightly News. And I can't list them all. That's how many there are. But these are really hard-earned recognitions that reflect your work and the work of our colleagues, and they're further proof that our story, the VCU brand, is growing in national prominence. National prominence also allows VCU to help to continue to attract top talent from around the world right here to VCU. Last fall, we welcomed Fotis Soteropoulos as our provost. Fotis has quickly become an impactful leader at VCU, focusing on prioritizing key faculty and student outcomes for VCU. Fotis will share his vision, by the way, for academic affairs on February 28th. His vision is for growing research, creating transformative student experiences, and embracing inclusion. He is my partner in all of those things and has been wonderful. He's going to help VCU to grow its national impact and reputation, and of course, to continue to embrace all of our students in every way that we possibly can. He knows, like I do, that our students' needs are changing every day, and we need to meet students where they are. Our successful athletics programs are another way that VCU continues to be featured on the national stage. The Rams won 6 Atlantic 10 championships just last year. Our exciting men's basketball team earned a bid to the NCAA tournament for the 9th time in 10 years. And all of you remember Bones Highland? Well, he was named A10 Player of the Year, but you also might remember that many of us watched him as he was being drafted in the first round of the NBA draft. So, with that, I'll say go Rams, and of course, we'll continue to keep going. You can applaud to that if you like. Maybe I need to say, go Rams, and then you'll do it. Well, last week, something really special happened. This group a national group called the University Innovation Alliance, they invited VCU to become the 12th member institution of this alliance. So this is a really pioneering consortium of national public research universities that are just dedicated to one particular thing. It's increasing the number and diversity of college graduates. They share that wonderful vision that we have for our country and for all human beings. So we will be there along our partners like Arizona State and Ohio State, Purdue, UC Riverside, and many, many other really impressive institutions. I've gotten to know all of the presidents and continue to get to know lots of the other folks who are there. They have so much great energy, and together we'll inspire and lead other institutions to improve their graduation rates and to improve opportunities to really lift people's lives across the socioeconomic spectrum. And of course, what we really want to do is we want to lift the lives of particularly low-income students, first-generation students, students of color. I'm talking to you about the people who have not seen the same levels of success that we want everyone to see. We do this because it improves the human condition, and it is imperative for individual and social mobility and U.S. global competitiveness. When everyone does well, we each do well. Membership in the Alliance is really a tremendous recognition of VCU's commitment to enrolling, but also on time graduating all students who come to us. I'm really proud that our work, placing students' needs first, will be featured on the national stage. More national... We'd actually worked out so that there would be people who would applaud at the right times, and they're just not doing their jobs. More national progress actually came this past year when VCU totaled more than $363 million in sponsored research funding. That total is an institutional record, but I want you to know it represents about a 25% increase in just less than the past 3 years. So according to the NSF, the National Science Foundation, VCU is now 58th among public research universities and for federally funded research and research expenditures, I should say. I want to be clear, federally funded research expenditures. But what that does is it puts us within very near reach to being in the top 50 in the nation, something that we set a goal to do a long time ago. So I'm talking about research funding because research and research funding, it matters because it allows VCU to lead in these areas that improve the quality of the human experience and the human condition. These are the things that are essential for our existence and for the quality of all of our lives. If you can't look to universities for this, where can you look? So it's a tremendous honor for VCU to be among Virginia's top 3 public research universities. We're shaping solutions and building an economy that's designed to pull in and lift the lives of everyone. One of our most promising research ventures that many of you have heard about, but it can never be talked about enough because of its impact, is the Medicines for All program in our College of Engineering. This is a program that's dramatically improving global access to life-saving medicines, partnering with the School of Pharmacy and various other schools throughout VCU. It's supported with millions in funding from the federal government, but also from the Bill and Melinda Gates Foundation and other sources. This is reimagining every step of the pharmaceutical manufacturing process, the same process, remember, that's left us largely short of a lot of essential medicines that we require, particularly generic medicines, for people to stay alive. So we're designing a better future because at VCU, leadership means doing difficult things that others can't, or maybe I should say that maybe they won't. Designing a better future is one of the reasons that we're recalibrating our Quest 2025 strategic plan. So this is the plan you might remember that was developed based on the assumptions that we had back in 2018. Since then, the world has changed dramatically, people have changed dramatically, and of course at the center of our world and mission, students have changed dramatically, the needs of patients have changed dramatically. Similarly, our strategic priorities have got to be refocused more narrowly on the needs of our students and our patients. So we've sought feedback from our faculty colleagues, staff colleagues, students, alumni, employers, and all of our communities throughout this process. So what we'll do is we'll share findings and recommendations with the VCU community in the coming weeks. And then we're going to submit the recalibrated plan to the Board of Visitors in May. So as I look to our future, it's really clear to me that the needs of our students come first in everything that we do at VCU. And I say that because when I came, that was the first impression that I had. When I met faculty in particular, I could tell in every conversation, our faculty put the needs of our students first. Focusing on transformative experiences is how we'll help them and VCU reach our fullest potential. This will continue to be our guiding goal. One of our transformative innovations that I'm really proud of is how VCU's retention and graduation rates are above the national averages, considerably above the national averages, and continue to rise in a more than a decade upward long trend. We also continue to close the gap for graduation rates for our underrepresented minority and Pell Grant eligible students. They're doing really well. Many years they are ahead of the overall average of this institution. You might remember, some of you, that last year the governor's office recognized our student-focused work by naming Vice President Tamikia LeGrand a champion of change for leading VCU's work on our Student Financial Services Center. Tamikia is back there in the second row. You could tell because the applause came from around here. So this was really, really cool. Recently, I had the opportunity to actually meet with Tamikia's financial counselors. So this is a group that works with students one-on-one. Oftentimes, their families are involved as well, by the way. They provide them with timely and accurate information about their finances, skills that'll last them a lifetime, not just focused on financial aid. So let's take a breath here, look back at the screen, and learn a little bit more about this center. Hey everybody, here we are again in the center of VCU's Monroe Park campus, where we're going to go in and talk with Margaret. Our focus, of course, is the success of our students, and we're going to hear a great story from her about her interactions with the VCU Student Financial Management Center. Come on with me. So Margaret, tell me a little bit about your experience with the VCU Student Financial Management Center. How is it making a difference in your life?
If it wasn't for the management, I don't know how I would have been able to apply, because I asked my mom, she'd be like, she doesn't know what to do, and I didn't want to miss anything because I have financial difficulties. I call them every day when I need help. No matter how many times you need help, call them, they're ready to help you. With their help, like this semester, I didn't pay for anything.
Do you think that your experiences will make a difference in how you manage your money after you're a graduate of VCU as well?
I would say yes, because they don't just tell you, oh, you just need to pay your tuition. They tell you, oh, this is how you can manage your money. This is how much you can save after the refund. This is how much you can invest in tuition. After tuition, this is what you can do with the rest of the money.
Rather than have students figure it out, we want to try to help ensure the success of all of our students. So it sounds like this is working. So as you've heard and seen, VCU is dedicated to make a difference in all people's lives. So listen, let me go back to where I started. You might remember I started out talking about Todd and Arun, so let's go back to them. And we have really, really big news. In December, you might remember that we announced that we created VCU's new Liver Institute. So this institute is a one VCU vision that unites our deep clinical strength with complex disease and research excellence to create a transformative innovation for the university, but also for healthcare. We've had a deep and successful history, as many of you know, in solid organ transplantation, and that, of course, included the liver. Because of the work of Todd and Arun and so many others who are around this work, we're learning more about the connection between the liver and critical conditions like Alzheimer's disease, diabetes, heart disease, cancer, and so many more. I could go down a very, very long list connected to the liver. Liver disease, by the way, is one of the top 10 factors that reduces life expectancy in the United States. And I must mention that it disproportionately affects particular underrepresented ethnic populations. Todd and Arun's work is critical to saving more lives and meeting patient needs. This is a moment at VCU when our aspiration is an absolute match to our ability. When someday becomes right now. It's with tremendous pride and gratitude on behalf of all VCU that I share that Todd's Family Foundation has donated $104 million to fund the new Stravitz Sanyal Institute for liver disease and metabolic health at Virginia Commonwealth University. So, this is a gift that really represents a tectonic shift in VCU's journey, and it's going to set a new vision for our new institute. So, a couple of things about this contribution. It is historic. It is the largest individual gift in VCU's history. It is the largest publicly shared gift for liver research in U.S. history, more than 4 times beyond the previous last gift, by the way. And it is the second largest publicly shared gift to a university in Virginia history. That is history. As part of this gift, Todd's Family Foundation is also funding 2 endowed chairs. One is the Arun Sanyal, Endowed Professor of Medicine. Arun, can you stand just a minute? And the other is the Philip Heileman Endowed Professor of Medicine and Microbiology. Please stand, Phil. Thank you both. We'll hear a little bit more from Arun soon, but I'm really grateful that we have this chance to recognize you, Phil. This is really an important thing for us. It's a great thing to do with you, and I was talking about all of those faculty members who I met when I came, who you could feel it. Their energy was geared toward ensuring the success of our students. You are one of those. So Phil joined VCU nearly 50 years ago, and he's an incredible researcher, an incredibly accomplished researcher, mentor, and teacher. I can't tell you, Phil, how many alumni have told me, Dr. Heileman was so wonderful, because you are. But Phil was one of those visionaries, along with Dr. Reno Vlasovic, who dreamt of a liver center at VCU. We're grateful to Dr. Vlasovic, Dr. Heileman, thank you as well for all of your contributions, and congratulations to you. Are you surprised, Phil? He's floored. So, this is a gift that validates our ability, our ambition, and of course, our ambitious vision. It is generous, Todd, but it is generative. This will make a difference like so few other things could at VCU. This is a gift about what's near and dear to my heart. It's a gift about patience. It's a gift about learning and learning experiences of our students. If our students all leave here with a better understanding of the importance of the liver and overall metabolism and human health, we've accomplished something huge. It's about the power of medical research and transforming people's lives. And it's about VCU being on the cusp of really changing medicine as we know it today. It's about putting patients' needs first, because that's very real. The very real fact is that the liver has tremendous bearing on human health, and it has not been the focus like it should be. This gift will allow us to bring together top teams to deliver clinical care, to ask critical questions that have not been asked, to develop new tools, to explore what causes liver disease, how we stop it, how we prevent it, and hopefully how we reverse it. These are teams that will represent the full VCU enterprise, including medicine, of course, but engineering is going to be important to this. Nursing is going to be important to this. Pharmacy, social work, the arts, business, and VCU Health. Now, rather than have me tell you anymore, I'd like to have our guests of honor, Dr. Todd Stravitz and Dr. Arun Sanyal, I'd like to ask you to please come up and join me right here on the floor. So we probably need to do this like we do in the classroom, since I'm a little closer to you. And just pull it a little forward and your voice will be heard relatively well. And those new N95s actually work relatively well too. So Todd, once you get your mask fixed, and it doesn't worry me, tell me, why this gift and why right now?
Thank you for your beautiful dedication.
It's my pleasure, Todd. And thank you for the gift.
For 30 years, I've come to work and done battle with liver disease. And mostly, especially when I was a young doctor, it was a losing battle. And so that's the why. Why now? Because we are really in a cusp of tremendous research-oriented advancement in medicine that should allow that persistent, high death rate to be brought down.
Thank you. That says it all, and it says it well, Todd. Thank you very much. Arun, so when I first met you, when I first came, all of our conversations were about the liver, and I continue to enjoy learning so much from you. I've been in your clinic with you. He's even scanned my liver, just so you know. And I became very curious as he was talking about this, and we had a patient there, and I said, since we're done, could you just check me out too? And because I became so much more aware of the importance of the liver. But Arun, you've got to tell us, why is this so unique, and why is it that the rest of the world has not seemed to figure out, even in the context of medical care, the importance of the liver? What's going on, and how is this going to change the world here?
Well, historically, there has been stigma associated with liver disease. Mm-hmm. And there's a popular perception that if you have liver disease, you must have done it to yourself. But that's not true. We know that. And this is really a critical time where we need to increase awareness around liver disease. There are also other factors such as, in our training curriculum in medical school, there's barely any mention of liver disease. While we spend a lot of time focusing on important things like cardiovascular disease, cancer, etc., there are other diseases which are very prevalent, create a tremendous burden of disease within our communities, but they are not really covered. And I think this is an incredible opportunity for us to change that paradigm.
We look forward to that because so many more lives can be saved. I talked about the statistics earlier. Todd, as you think about this, what do you really want the legacy of this gift to be? Because it will obviously outlast all of us, right? So what would you want to see the legacy be?
I'd like to see the legacy of the VCU liver section and the Institute to be the recognition that VCU was at the forefront of research that made liver transplantation really unnecessary for almost everyone, that we were able to identify patients and treat their liver disease well before they needed a liver transplant.
Sure. Now, that is an important legacy. Arun and Todd, one of the things, Arun, you taught me early on was, and you showed me literally, the connections between the liver in the gut and everything else that's going on in the gut. How can we raise everyone's understanding of this? What do you two envision to be our ability to take what we learn and, of course, bring it to the patient's bedside, but to more broadly communicate to the public in the context of public health the importance of liver health?
Well, I think we should do what we've always done, lead with good science. There are still many knowledge gaps, and what this institute will allow us to do, and Todd's exceptional gift is going to be an incredible accelerant for this process, is to create the toolkits that the scientists of tomorrow will need to tackle the kind of health challenges that our patients are facing. It will also allow us to create a translational pipeline so that there will be a focus through every aspect of what the Institute does that is patient-oriented and designed to make sure that the concepts that we have in our head turn into molecules in our labs, and the journey of that molecule from our lab to a capsule in your local pharmacy is shortened. And we don't stop there. We need to make sure that we not only create the drugs and the therapies, but we can actually get it into the hands of the people who need them. And that's yet another step. And I think what this incredible and exceptional gift does for us is provide us the resources to really tackle every step so that the weakest link is no longer the weakest link. And every link in this chain, from our ideas in our head to treatments at the bedside, is as strong as it can be.
So if you look back over the last at least 100 years in medical education, we've tended to teach, not necessarily in the last 10 or 15 years, but we've tended to teach with an organ systems approach to things. And so, I have to say, and I'd like you to agree or disagree with me, that we put a lot of emphasis at VCU on solid organ transplantation. We put a lot of emphasis on cancer and cancer treatments, innovation there. The heart, obviously, has been a huge investment for us and the Pauley family and such. So I actually see this as enhancing all of those things. Our commitment to children's medicine, right? By the way, kids have livers too. But isn't this going to just enhance everything that we do at VCU by putting the context of liver metabolism and liver health into it?
I hope so, and I very much hope that we incorporate and focus on liver disease in children. Liver disease in children really hasn't received nearly the focus in research that it deserves, and it's completely different than liver disease in adults. So, I certainly think that we need to be inclusive about our pediatricians and our ICU doctors and our hem-onc doctors, and I think you're absolutely right that this will bring the medical campus together, including our Department of Pediatrics.
Awesome. Thank you so much, Todd.
I would add to that by saying that as we learn how the liver plays a central role in our entire body's metabolism and allows other organs to be metabolically healthy, which then provides the energy that allows them to stay alive and function, we will begin to build bridges towards the important work being done in the Massey Cancer Center, with Wright Center for Translational Research, Addiction Medicine, with the Pauley Heart Center, because what is happening in the liver is impacting all of these different processes. And as we understand better how liver and its role in metabolism impact all these different conditions, it will build synergy with all of these other centers that exist at VCU. And together, the whole will be much greater than the sum of the parts.
So this is obviously a transformative innovation, Todd, and to your entire family. Thank you for helping to lift this vision that we have long held to a new level and helping VCU to make a difference not only in the VCU environment, but realistically in the world. This is going to be very, very big news because it will finally occur to people that there is a connection that is very, very important. So this is a great way to wrap up this State of the University address. I really appreciate your willingness to come and talk with us. And to all of you, thank you for joining us. I have to tell you that this is a great example of putting students and patients' needs first. And I also want you to know that this is the beginning. The best is yet to come. Thank you.